Hello, and welcome to today's episode on laryngopharyngeal reflux and the reflux symptom index. Since we made our draft, there is a book of Phoniatrics where we gladly inform you that Vishin Wursar describes the difficulties with diagnostics. High speed is not yet included. We will be going over each question and giving a visual representation of each symptom. Hoarseness or other voice problems, clearing throat, excess throat mucus or postnasal drip, difficulty swallowing food, liquid or pills, coughing after eating or after lying down, troublesome or annoying cough, sensation of something sticking in the throat or lump in the throat, heartburn, chest pain, indigestion, or stomach acid coming up, hoarseness or a problem with your voice. Hoarseness is a widely used description of a symptom where something is wrong with the voice. The complaint is evaluated by the client and doctor together and divided in points up to 5. The patient evaluation is of major importance. In the video, you see the marking of the center of the vocal ridge used for making phonovibrograms to the bottom left and single movement of the top left with the area description. Notice that there is some irregularity in the movement on the film, which is also seen on the phonovibrogram with a mucus bridge in the middle of the especially one vocal fold, as well as pressure in the back and progressive opening phase on one vocal fold towards the end of the recording. On this video, you see the mucus bridge in the front and the pressed vocal folds in the back, also reproduced on the trajectory in the beginning as well as in the end. Clearing your throat. Whenever a client is clearing the throat, mucus is present. Some clients are denying the existence of clearing the throat. Mostly the doctor notices it early on in the consultation. This video is of a client with massive reflux and edema of the arytenoid region and a lot of mucus. Excess throat mucus or postnasal drip. Postnasal drip is felt in the pharynx area, and there is a differential diagnosis to infectious pharyngitis and tonsillitis. In the case of postnasal drip and excess throat mucus due to reflux, the mucus comes from the esophagus. Certainly, the acid and enzymes can irritate and provoke the edema. The problem will disappear with treatment of the reflux. Note the swollen false vocal folds. This patient had a serious cough. Difficulty swallowing food, liquids, or pills. The complaint of difficult swallowing is absent in most patients with reflux. Still, when the diet is discussed, the clients have mostly noticed some food which provokes difficulty of swallowing. Coffee, tomatoes, spices, etc., and swallowing problem disappears when they remove these items from the diet. The picture shows a phonovibrogram with a mucus bridge in the middle of the right vocal fold and a little bit of reflux, especially on the left side. There is also some insufficient closure on both sides in the front. After treatment with lifestyle adjustment, there is a compensation of the insufficient closure in the back and the front is closed. Coughing after you ate or lying down. As for cough, there is a special questionnaire made by Jamie Kaufman, which is of great value. The important thing is, of course, there can be other reasons for cough. Note that you can differentiate to some extent whether the cough is referring to laryngopharyngeal reflux or other disorders. Cough is a problem of its own. We have decided to present the scheme, but cough is also in many cases due to lung disorders, allergy, neuromedical problems, environment, and others. Breathing difficulties or choking episodes. If the larynx is very swollen due to reflux, then the patient has breathing problems. Mostly the complaint is also of a lump in the throat. Question 7. Troublesome or annoying cough is related to question 5. Sensation of something sticking in the throat or lump in the throat. Of course, there is many degrees of lump in the throat because it is dependent on how swollen the arytenoid and in some cases the whole larynx is. Heartburn, chest pain, indigestion, or stomach acid coming up. Gastroesophageal reflux symptoms are to some extent similar to the ones we presented with laryngopharyngeal reflux. This patient had diagnosed gastroesophageal reflux, typically seen on the high-speed film with edema of the arytenoid region and insufficient closure of the rear vocal folds. In the beginning of the phonovibrogram is a pressed voice in the back of the vocal ridge due to compensation, and in the end of the recording you see the opening of the vocal ridge. Heartburn and chest pain are typical for gastroesophageal reflux. The reason for a difference to laryngopharyngeal reflux symptoms is not clear, probably more due to enzymes than acid, which also might be the reason why lifestyle adjustment is so effective for laryngopharyngeal reflux. Thank you for watching, and we'll see you in the next one.